I'd like to invite you to our CMMS Club this week, Saturday, which is going to be 5:30 PM Johannesburg time. I'm going to be demonstrating 3 very difficult cases. And these are cases where you would honestly think that therapy would not help the patient at all. Our first case is a patient who had a spider bite injury about 15 months ago. And I casted him effectively in December, and he had 60 degrees of flexion and he had a straight finger. He then defaulted on therapy, and what ended up happening is he had a deviated PIP joint, a lateral deviation of 40 degrees. And so the surgeon said to him, look, this joint is fused in a lateral position. There is no active flexion and we need to fuse it.
So last year, December, Miss Robin had me in a full CMMS cast that was supposed to help with my flexion on the finger. And it was so frustrating. Every time I would see her, I would just come and I would complain and I would cry and I would whine and I'd be like, I can't do this. Please, can you take it off? And it was always 2 more days, 2 more days, 2 more days. And I got fed up, like, because it was messing with my mental health a bit. And I cut it off. I straight up stripped myself out of the cast. I don't think I saw you after that. I think I ran away and I only returned now, 6 months later. But after returning 6 months later, we now lost that 60 degrees flexion, and now we have to recover the finger from being angulated to being straight. So like, it was really a journey, but like I couldn't. Like, it was just something that messed me up. So we went into a cast now for the finger, and I would say that I did pretty well. We did 10 days. We went from 40 to 20, and we're now aiming for 15
Yes.
on this joint bend here, trying to recover it. So, because we can get it to heal, and we can already see that there's a lot of progress already just by the first session, and it's gonna be straight.
It will be straight. So I've been combining CMMS with energy medicine. What was the first thing you asked me for today?
For tuning.
Tuning.
Yes.
Yeah.
No, because I definitely know that the tuning does help. Like, having the joint restricted because of the blocks and having them tuned out has definitely been working.
We are using a static progressive POP splint as well as thermoplastic splints to straighten the finger. So it's just a really interesting case where you would think you're getting no results, but I've seen him today and we have already achieved 20 degrees and now we're aiming for another 5 to 10 degrees. The second case is a patient who had a bypass operation. Today I'm going to take you with me on a home visit. And immediately as he came out of the surgery, he started screaming with excruciating pain in his right hand. Anyway, they've done all kinds of tests and they don't know what's wrong, but they do know that they had an AR line into that region. So I think that the median nerve was damaged, and as a result of not having a C-bar splint to open up that web space, he now has a web space contracture, and he's got stiffness of his fingers, and he's got still some pain and very hardened thenar eminence. So I did do my energy medicine on him, and he had a good response. And we'll assess the carryover when I see him today, but the problem is the web space and the finger stiffness. My colleague Paula Samaro and I are busy submitting a paper to one of the journals with regards to using the CMMS technique with stiffness in the thumb. And we have come up with an incredible protocol and a particular staged effect with how to cast the thumb. So today I'm going to show you how I cast the thumb and how I'm going to be achieving thumb abduction as well as initially IP joint motion. The second stage will be to regain MP joint motion and improve the finger mobility within the cast. So this cast is going to be addressing the thumb and the fingers. The other beautiful thing about the cast is that it does seem to do very well with any kind of nerve compression or any contusion or damage to the nerve. We've seen this with ulnar claw deformities. And now I'm going to see what it can do for the median nerve. So I look forward to showing you what I do today and how a very unique approach for this patient is crucial, because if we do not cast him properly and we do not open up that web space and release that nerve and lift the skin and regain motion, he's actually never really going to regain function of his right hand. So let's see what we can do for him. All right, so this is a very special case because it's an iatrogenic insult to the nerve, which has resulted in damage to the median nerve, to sensory and motor function. There's a contracted web space. There's wrist activation during finger flexion. There's stiffness at the MCP joints. So this hand's web space is 14 centimeters, whereas the other is 8 centimeters. All these MCP joints flex to 90 degrees, whereas on the other hand, it ranges from about 70 down to 60 degrees. Both MCP joints are good at 60 degrees. The IP joint of the left hand has 90 degrees, but only 60 at the IP joint. And the third case is a patient that had failed trigger finger surgery. In fact, the first injection actually resulted in a collapse of the MCP joint and a swan neck deformity. He then went on to have 3 failed operations, and he was like coming to me as a last resort. There was so much scar tissue, shortened intrinsic, swan neck deformities, and absolutely no IP joint flexion of the little ring and middle finger. And I've achieved some remarkable results with him. Paul, how have you felt in the cast?
Yeah, look, I've dealt with it.
What have you noticed with the improvement in your movement?
Well, the fingers seem to move more freely.
Yes,
know?
and they're bending.
Yeah, and they're bending quite well, actually. It's a big improvement.
It's a huge improvement.
Yeah. And you know, it's, you know, I obviously it's just the beginning, but you know, I mean, we're working on it, and but it's making headway, you know.
And then how have you felt the virtual hand
Yeah,
tuning
very good.
sessions?
I enjoyed them. Yeah.
Could you feel a difference? Could you feel what I was doing?
Yeah.
Do you remember
you
what
got to focus on it? Yeah, I mean, you got to. Yeah, no, I remember it. Yeah, I remember it clearly. Yeah.
Brilliant. So it's worthwhile to do those in between these sessions.
Yeah.
And you know, you can play them over and over and over again.
Yeah, I got that. Yeah, that's what I thought.
Yeah. So it's like you can have a session every single day, which is so nice.
Yeah.
For the Legacy Sims Pro Club members, they're going to see me doing my energy medicine on 2 of those patients on a private portal. But for everybody else, I would just like to show you what is possible with Sims and invite you to this complimentary session on Saturday. So please click the link to sign up and come and see what it is that you can achieve with your patients. And just remember, these are all last resort cases where you would honestly think that surgery is the only answer. But it's not. We are able to do so much more. Thanks.